BBS UK Clinics Support Service. The NHS-commissioned BBS clinics offer both face-to-face and virtual appointments to those living with Bardet-Biedl syndrome. At each clinic, patients are seen by an ophthalmologist, eyes, nephrologist, kidneys, dietitian, food and nutrition, clinical psychologist, geneticist, genes, speech and language therapist, and endocrinologist, hormones. BBS UK are contracted to provide support and facilitation services, and this year our team will be supporting 19 virtual clinics and 15 face-to-face clinics in Birmingham, and 9 virtual clinics and 16 face-to-face clinics in London. Both the Birmingham and London clinics have had a great start to the year. We have seen an increase in new referrals with higher numbers of new families coming to the clinics. This means more people with BBS are getting the support they need. After each clinic appointment, we ask patients to complete a feedback form so that we can continually improve. The feedback about the entire clinic service received has been very positive. Quotes: very knowledgeable and well explained. Looked after all our needs, and we were in ophthalmology for ages, but they never left us. I liked that accommodation has been given to us, so we did not need to travel back and forth. Staff very welcoming. It's been great to get the assessment done in one day. Everyone has been very caring and helpful. They were able to review my eyes properly and make me feel confident. End of quotes. Thank you to all the BBS clinicians for making this possible. News updates. The BBS clinic at GOSH, that's GOSH, Great Ormond Street Hospital, has moved. You will now find it on the 4th floor rather than the 2nd floor. Everything else remains the same. Unfortunately, the GOSH service is still unable to provide lunch to patients due to the hospital trust policy. We really hope this will change soon, but in the meantime, please bring food with you as it's a rather long day. We will still provide tea and coffee on Friday morning, so if you have your own travel cups, please bring them for us to fill, as we like to be as green as possible. In October last year, GSTT, Guy's and St Thomas's Hospital started using a new computer system with a patient portal called My Chart. This allows GSTT patients to access their clinic information and medical test results. If you do not have an account yet, please contact Angela Scudder at angela.scudder, that's SCUDDER, at bbsuk.org.uk for a setup code, or we can help you during your clinic appointment. Dr. Denise Williams, genetics consultant at Birmingham Children's Hospital and Queen Elizabeth Hospital, is retiring this year and will be leaving the service from the end of May 2024. We would like to wish Denise a wonderful retirement and send our heartfelt thanks for the outstanding support and service she has provided to our families over the years. She will be sorely missed. In January, the London service welcomed CNS Katie White to the team. Katie will work alongside CNS Kath Sparks. We were over the moon to hear that one of our GSTT patients has become a mum to a beautiful baby. Congratulations. We've also heard of many engagements and weddings within our community and offer our best wishes to all those celebrating. Transition events. The thought of moving from children's clinics to adults' clinics can be a daunting experience for the young person and their family. New doctors, new schedule, at a new hospital. What will the day look like? To support our young people with their transfer from child to adult services, we have started a new transition event. Young people and their parents or carers will be able to discover everything they need to know about the adult clinic with the familiarity of the BBS UK team at their side. The day will include an orientation visit to the hospital to familiarise them with the surroundings and enable introductions to key members of staff, including the Clinical Nurse Specialist, CNS. Last November, we held our first transition event in Birmingham for 12 young adult patients. They familiarised themselves with the Rare Disease Centre in the Heritage Building at Queen Elizabeth Hospital and met the CNS Sarah Borrows, who introduced the service. Transition Coordinator Marie McGee guided the visit, providing insights into managing changes and key milestones in young adults' lives, preparing them for the transition to adult healthcare. After the hospital visit, we checked into the hotel and then went out for a social event, enjoying a meal and a game of bowling. This gave the young adults a chance to mingle, while parents and caregivers had the opportunity to chat with other families and the BBS UK staff team. One attendee said that the transition event made them feel less worried because they now know and understand how the adult clinic is run, and another said that their first appointment in the adult clinic was far easier than expected. Our next Birmingham transition event will take place on the 14th to the 15th of November, with another 12 young adults transferring over to the Queen Elizabeth Hospital. This time we have the pleasure of collaborating with Anne Chesborough and the SENSE team at Touch Base Pairs in Birmingham. After the orientation visit and meeting with the hospital team, we will go to Touch Base Pairs to participate in a workshop covering topics including employment, college opportunities and future planning. Once again, in the evening, we will enjoy a fun social activity, providing the opportunity to make friends and share experiences. Our first transition event in London will take place in July, helping 6 patients to transfer from Great Ormond Street, Gosh, to Guy's and St Thomas Hospital, GSTT. Most patients will already be familiar with many staff members we will be inviting, such as Sarah Flack, our dietitian from Gosh, who will be doing the joint consultation with Ken, our dietitian at GSTT. Rebecca Perfect from the BBS UK Advice Service will be joining Angela and Shirin for the event, and together they will give a tour of the hospital and patient hotel. Patients and their families will also be introduced to some useful members of staff who will be full of information to help you transition into adult services, including our Eye Care Liaison Officer, ECLO. These fantastic events are open and free of charge to all young people attending their first transition clinic, and we hope that all those invited will make the most of this wonderful opportunity. BBS UK have a transition handbook for young people living with BBS called My Life, My Future. This valuable booklet has proven to be a useful toolkit of information to support older children with their independence and self-advocacy. It is also a useful resource for supporting conversations about transition and future opportunities and choices with younger children. You can find this on our website. Cancellations and did not attend. We have noticed an increase in the number of cancellations and instances where patients miss appointments without giving notice. We understand that this is sometimes unavoidable, but with limited appointments and growing patient numbers, BBS clinic appointments are a truly precious resource for the ongoing care of everyone living with BBS. Appointments can also take a lot of time and resources to organise, and sometimes it just isn't possible to fill a late cancellation. By letting us know as soon as possible if you need to cancel, you will be helping someone else with BBS get the appointment they need and helping to keep waiting times down for everyone. We urge all patients to attend their scheduled appointment. However, if you do need to cancel or rearrange, please contact your patient liaison officer as soon as possible so we can offer the appointment to others. If you're open to last-minute cancellations, please let us know.